everybody. Welcome back to the WISeKey webinar. Today, our focus is going to be, as announced, AIoT and cybersecurity in the COVID-19 age. So I have the pleasure to have with me today a list of very impressive speakers, and they are all working on different technologies and policy and regulations to ensure that we can transform this COVID crisis into something that is bearable to the society, and we can, as soon as possible, regain some kind of normality in this very complex situation. So I have the pleasure to have with me today on this panel Chris Voss, the Managing Director and founder of Arago, a artificial intelligence company in Germany. We also have Pascal Brüchner, Director of ITS and CIO of the International Association for Transport, IATA, which is the focal point of the United Nations to the airline industry. Also Gianfranco Moy, Digital Transformation Officer of the State of Geneva. We're also going to have with us Anjita Pathanathan, which is a physician, medtech, and advisor, and also CEO of Klein IQ Healthcare, a very interesting startup that she will introduce to us. And Konstantin von Gersdorf, CEO of Digital Diagnostic AG, another German company, and Pierre-Edouard Sotas, Chief Scientist Officer on Core Medica Europe. So we selected a list of speakers, and they do represent both the policy issues related to how the airline industry, for instance, is getting ready to reactivate it back again, the possibility of including passengers into planes, and talk to regulators in order to make that happen. We also have perspective from the government, concrete cases on how governments like the Geneva state government is working towards creating an environment that could reactivate the economy as soon as possible. And then we're going to discuss also the concrete areas related to the technology. So the webinar is going to be run in two phases. The first phase is going to be around the technology aspect, how IoT, AIoT, artificial intelligence of things, IoT, blockchain, analytics, and access control technology, and cybersecurity, how that blends into solutions, concrete solutions that, together with companies that they are working on the COVID front, diagnostic companies and clinical assay companies can really develop concrete solutions that we can put on the market. So among the speakers, we will also have announcements on concrete case studies and in applications and implementations that they are happening as we speak. So this is going to be run as kind of a web model. So I'm going to be moderating. I will be inviting the speakers in different sessions. Then you have also the possibility to address your questions in a Q&A using the Zoom button on Q&A. And you will also be able to relay the questions directly to me or directly to the participants as you wish. So maybe to start the debate, maybe the first part of the debate, I would like to focus on cybersecurity and the need for digital identification and privacy and security of the data that those devices are collecting now. Many governments are redundant to make those devices mainstream. The reaction of the population has not been as expected. Some citizens in many countries, including Switzerland, they have been kind of concerned about who owns that data, how that data is being used. So maybe we can start the discussion, and maybe I can open with you, Gianfranco, as running the State of Geneva projects in this area. What is your experience on the government reactions and how citizens are reacting towards this innovation, and what are the technology challenges that you see happening there? So maybe we can do a short introduction on Gianfranco on the issue, and then we will just introduce the speakers as a way for you to get acquainted of who they are and in what sector they are deploying themselves. So Gianfranco, the floor is yours on that question.
Thank you, Carlos. There is quite a bit happening actually at the state and Geneva and in Switzerland in general and in Europe as well regarding this issue of data security, data privacy, and in connection, of course, with this new technology that is being deployed, IoTs in particular, but also 5G. There's a lot of discussion around the health implications of deploying 5G, for instance, here in Switzerland, and in other countries, European countries as well. As far as the issue of collecting data, we're very concerned about doing it in the right way. We have several projects that are being considered right now around smart city, for instance, where we have a number of IoT devices being deployed. Just to give you a perspective, for instance, public utilities would be deploying 250,000 smart meters in the next couple of years. We have devices that will, sensors that will capture noise, presence, light, pollution, traffic, and so forth. So some of that data collection could be somewhat invasive from a personal standpoint. And so we are very sensitive to that aspect as well. So I mean, there's a lot of opportunity, of course, to make it, more, I would say, efficient from a governance standpoint. The environment can be much smarter. But at the same time, we have a contention with the fact that all this data that we're capturing needs to be secure, and the confidentiality has to be, protected.
Thank you very much, Gianfranco. Maybe on that same question, agenda, you are also very active working with some governments, maybe more also from the clinical assay point of view. Maybe some views on cybersecurity. Is that security basically a obstacle? Will by solving the cybersecurity issues, we will have more acceptability in governments? Maybe your views on that, please.
Hi, thank you, Carlos. Yes, so I come from a clinical background, anesthesiologist by training, and then I did some work in other clinical aspects, aeromedical retrieval and remote care. So applying kind of the clinical lens, as we move the physical consultation onto a digital platform, we still have to think about the same things such as confidentiality and privacy. And I think the cybersecurity aspect is that through the pandemic, we've seen over 5-fold increase in cyber threats. So we have to be very mindful of how we develop these solutions. That said, I think that with working with experts and, applying the various cybersecurity threat models and making the solutions as robust as possible, we can still deliver a very good solution for remote care and pandemic care. So I think that it is a problem, but if we recognize the problem, we know how to manage, then we can take steps towards managing the problem effectively. So I don't think it's something that individuals should fear necessarily, but it's something that we should definitely address.
Thank you very much, Agenda. And maybe on the same question from the regulator's point of view, and particularly Pascal, on your experience with IATA, what are the minimum requirements for regulators to feel confident on this technology and basically open a bit their position, as I think the lockdown now is mainly due to regulators not letting countries to travel between themselves. Any views there?
Yes, Carlos. So if we want the regulators to be confident, I believe that first we need to convince the passenger also that they can trust us in managing their personal data. And so what we have been trying to do with airlines, and we've been involved in all the discussion with the regulators, whether it is the civil aviation authorities everywhere in the world, is that we need to ease the exchange of information, but we need to passengers be always in control of the personal data that he wants to exchange with the different parties. And we need to deliver standards that will be scalable, that will be available everywhere, because we cannot have a different solution in every country. And so this is why that IATA has been working with the W3C and using standards and concept about self-sovereign identity. So using identifier that can be shared between an issuer, between a verifier, under the control of the passenger. And for that, we are using the mobile technology. We are using the IoT because we are going to use biometrics in order to verify, the identity on mobile device. So we have to bring a framework that will be secure by design, that will be scalable, where the passenger will be always in control to whom he wants to give his personal data. For example, airline, they don't want to be involved in a medical certificate. Of course, we understand that at one time we will have to provide, the passenger will have to provide a certificate in order to be allowed to board on an aircraft, and this is fine, it is something that we understand. But we just want to ease, the verification of this certificate, but we don't want to store the data. The data has to be stored in an environment that will be secure by design. And of course, we have many technology. Carlos, you know this technology better than me, using PKI, using blockchain, using an integration of all these technologies with also all the biometrics that will allow us to build something that will be secure and that we will be able to monitor, that we can guarantee the personal right of the passenger. If the passenger is convinced, believe that we will be able to convince the regulator as well.
Carlos, you're muted.
Yeah, by the way, it will be good and we all mute when we don't speak because sometimes it's a background noise. Yeah, I was saying that the identity aspect of this is essential, and this has been recognized by latest publication in The Economist and other. Then they say the digital identification, especially when it's decentralized and is available in ledgers, blockchain ledger for verification, and decentralized verification might be the best and easier way to start to solve some of the aspects on onboarding and access control for COVID-related users. So maybe on that, Constantin, you are the CEO of Digit, a very advanced diagnostic company. You have developed a 5-minute test, which actually could be a breakthrough if we can use it. Where are you on this development, and how what do you believe in terms of being able to work with regulators to accept this technology that you have developed as a easy way for passengers to board into planes and access into critical infrastructure?
Yes, okay. We have developed an antigen 5 minutes test that we're going to roll out in January. And the main USP, beside being a reliable test, is that we have a digital component in this test. That means that this test provides you the information where a measured person, negative or positive, is located. That means that by the moment you have tested yourself, you have a signal, and the signal says, okay, in a certain area you have a group of people who is infected, and then the entities are capable to react in a way. Yeah. This works for everything. You can use it in order to prevent spreading in the country, in an institution, on the airport. Yeah. The thing is, of course, what happens with the data that has been generated. On one hand, it is just a small signal that has to be sent anonymized, and we divide it in a general context. If you are measuring at a physician's place with a doctor or medical healthcare professionals, or if you're using it, for example, in the airport with the purpose to enter a plane and trying to secure that you're not infected by the moment you get into the plane. it is much easier to keep the personal data when you're sitting at the physician's place, because the physician has the data. It is only sending the signals from the doctor's place, but you don't know who is the patient who has been tracked. No, everybody who's measuring himself is able to get a certificate for himself in order to prove that he is infected or not. And the same works for in the airport. In the airport, we go a step further because by the moment you want to enter in a plane, everybody sees. They want to match it. They want to match maybe the ticket for the plane with the certificate that you're getting because you are not infected. So what we are doing is we are making a kind of that everybody is free to decide if he wants to take the certificate, and we only give you a positive, negative, okay, that you are not infected, a certificate, and by the moment you have the negative certificate, you can combine it with the ticket and enter the plane. So that would be much easier. And as the customer, the patient has an interest to get into the plane, he will be he's fine with that he has an app and he has already sent some personal data, but that by the moment it goes to the cloud, it's going to be completely anonymized.
Thank you. By the way, it's a question to you directly, so I'm going to ask you: what stage is the digit approval in Europe and FDA? Maybe you have some news on approval process and what is required actually to get approval. You know, I think it's important for everybody to understand that.
Yes, the approval is we have by Christmas we're going to have the European approval. Yeah, the FDA approval is going to take a bit longer because they want us to finalize a big study. Yeah, that is not necessary to have here in Europe. So we are ISO certificated 13485, and that means that by finalizing the product, we can enter into the market.
Very good. Thank you, Constantin. So maybe, Chris, AI, it has been remarkable, the poor use of AI so far in COVID. I mean, although the potential of AI is being well identifiable in the last years, but where can we really use AI? Obviously, I have some ideas, but you as an expert on AI and one of the pioneers in Europe, where do you think AI and companies like Arago and Hero could really make the difference in helping regulators and also citizens to accelerate this process of trusting and both using this technology?
Thank you, Carlos. I mean, that is a very nice question to ask. So I can really roll this out. And I'd connect it back to cybersecurity in a second. So I think that with artificial intelligence, we can actually determine the risk of every single person, whether they're infected or not, meaning that because we now know the risk of everybody, we don't need social distancing, mask wearing, or any of that anymore. And that's what we really need, right? Right now, we're deploying measures. We're doing half lockdowns of schools, lockdowns of or travel restrictions and all this. And everybody's very insecure. And it really impedes our economic life, but also society and business life. I mean, you can see what is happening. The levels of aggressions are going up and the results are pretty horrible. What we can do with artificial intelligence, because we are able to process data that quickly, we can take the results from testing, as Konstantin has described. And if the testing is available digitally, right, we can take it immediately when the tests have been performed. We can take the results from tracing, so who's meeting who, meaning if we meet, then we exchange risk, right? If I have an infection risk, you have an infection risk, we meet, we sit together, the risks mingle, and you and I walk away with a higher risk that we're now infected. But if we also do this to symptom control at the same time, meaning that after such and so many days, we've not been symptomatic, we can actually reduce the risk again. So the combination of testing and tracing and symptom control, there is a way to manage risk so that you have a secure bubble. You can have this for a venue, for example, or a trade fair, or an airport, or we could actually use the funnels of airports and airplanes to bring people whose risk we know back to resorts and hotels and events and concerts and all these things. And the job of AI is to do this evaluation of the results from testing and tracing and so on symptom control on what is actually the risk of every single person. And that way we can manage the risk without having a vaccine yet. And we can determine who can be part of this and who needs medical care, right? And this is a way to get back to capacity in our economy and to get back to capacity in our cities and airports and airplanes and tourism resorts. That's, I think, what we want without an elevated risk. I mean, right now, we're taking measures out of the system, like we allow people to travel and so on, and then they spread COVID into larger cities, as we see in Germany right now. A lot of that came from travel returns or people who went to some strange demonstrations, right? Now, all of this can be done. And now we've got to ask ourselves the questions, should it be done? And the only way to do this is through an anonymous system, right? A digital identity or the digital twin cannot be directly connected to the real person, except for if this person knows and wants. And this is why I think the personal identity should stay right where it is, and there should be a digital twin of this, and only the person can connect it. And I've also said the 3 ways that are in the system, tracing, symptom control, and testing, all of those need to be secured, right? We need to make absolutely sure that it's impossible to inject wrong data into this, because otherwise the entire risk management collapses. And this is why end-to-end security is just as important as the digital identity combining with the real identity of a person. So we can do this today. In fact, we've been running prototypes at large universities with 100,000 participants, and in an area where there's high infection rate, only have 1 infected person, right? So this is all possible, but it's only deployable in a liberal democratic system if we make sure that the data is safe end to end. We have to put certificates in, and I'd always vote for putting European certificates in, like you do at WISeKey. And we also have to make sure that there's a digital identity for these people, that they can be identified without revealing all their personal information unless they want to.
Thank you, Chris. Just maybe on stay on the same subject now with Pierre. I mean, this is creating an unprecedented amount of data, this crisis. The latest statistic is that we are collecting more data now than in the entire history on the internet. So how your organizations are handling with that data? How do you, first of all, what is the value of that data for organizations like yours, Pierre? And how do you process that data? And how do you ensure at the same time the privacy issues related to the processing of that data?
Carlos, the question is directed to me. Sorry, it was not clear.
I mean, if you want to react to that question, it's directed to you. Yeah, absolutely. Yeah.
Okay, sorry. Yes, for sure. Yeah, that's here at Comedica. Yes, we generate a lot of data. We are a laboratory, for sure. We authorized for COVID in 2020. And we not only actually measure some small panels, like just the test results are positive or negative, or for antibodies or antigens, all these kind of things, but we measure actually through mass spectrometry some very large panel. We are really in the field of big data, and for sure, for example, the profile that we sell these days is called the COVID-19 immunity profile, which measure very large panel of markers associated to COVID. We're hopefully one of the first to develop a test based on COVID already in March, and now I think it was a good idea to do that, and we test really a lot. So to answer your question, for sure, we generate such data about data safety, about how to report the result. For sure, it's crucial for us. Now in practice, since as a lab, by definition, data safety is so critical. And since the very beginning, in our case, we have to handle very big data. We also do, for example, some nutritional sport profile can generate up to 1 gigabyte of data per person. So we're really in the field of big data. So COVID, for sure, it's something for us that we had to switch. We had to validate this profile. From a regulatory point of view, it has been extremely, I would say, time consuming here. It took, for example, 3-4 months actually to go to Swissmedic in Switzerland to get the authorization to sell our tests. But the data themselves, how we secure the data has not been a main issue for us, because just we already know how to handle with this data.
Thank you very much, Pierre. I'll come back to you later on that so we can deep dive a bit more on that. But Aginda, the multi-tier testing strategy to ensure individual filter out, maybe you can develop a bit on that and explain to us some concrete cases where this is happening already.
Yeah, thank you, Carlos. So I think Hans touched on some very good points about the need for reopening borders and reopening society, because there's other side effects, obviously, such as social cohesion issues and cultural tolerance issues, and not to mention unemployment and various things. So it is very important. So what I think we have to trade off the risk between these activities and how safe we can make them. So safe, which Pascal will have the data, but IATA has produced information that 1.2 billion people have traveled through COVID, and there's only been 44 identified cases. So even if that's a gross underestimate by 90%, that's only 1 in 2.7 million people. Now, we can't necessarily compare apples with oranges, so we can't necessarily compare what we call morbidity data with spread risk. So when we look at that, we have to take a multi-tiered or multi-layered approach, which governments are doing, regulators are doing. So they're saying, testing, symptom management, as Hans has alluded to, face masks and localized lockdowns, individual lockdowns, regional lockdowns. So when we look at the airline industry, at the moment, there's pilots of testing happening. So United has started testing between San Francisco and, say, Hawaii. Now, there's only one test being implemented. Other regions, such as the Emirates, have asked for testing as well, PCR grade testing from one location to another. What we've seen is that, say, with the Emirates style approach thus far, people can present just paper test results at the counter. We know that that's highly insecure, because you can just, I went to the airline myself, I presented my lab test result and they said, oh, this is great to see, because some people have just given us handwritten test results. Obviously, we need to implement a more secure solution, such as a digital solution. In terms of the multi-tiered approach, so that's making sure we have, we're not dealing with fraudulent or other erroneous test results. So the multi-tiered approach is really taking a much more rigorous approach to testing and tracing, tracking, testing and tracing for border crossing. So we ask people to start screening, so putting in their symptom information into a digital tool before they fly, so multiple days before they fly, so that risk can be identified. Say with Chris's platform, we can do the risk predictive analytics, and then you can ask certain people who are high risk to possibly not travel, or ask for them to get testing at home in their location. So with that, they can get testing, and then you can screen out a certain number of people. And so you have a reduced risk of individuals who attend airports even. So you're reducing the risk of transmission at airports now. At the airport, you implement something like PCR grade solution, so LAMP or PCR-based testing so that you add another layer of security in terms of catching, the people who have infections. And you can add in things like multiplex testing. So by multiplex, I mean you test for COVID, but you can also test for other viruses that might be causing the symptoms of co-infections. So then you screen out those people. Airlines have done an excellent job at putting in air filtration, making sure their aircrafts are very clean. So you can also, maintain those measures, including face masks. And then if it's something like a long haul flight, you've got this, period of incubation. So you could even do pooled testing on the other side when people land. So before somebody enters a community, they've now gone through a 3-stage testing process or 3 testing. And we could do this relatively cost effectively. So Chris and I spoke about this, and we can get this even multi-testing strategy at sub the current cost of a single test. So this is a great way to combine both the AI, digital risk analytics, alongside our existing measures that governments are putting in place. And it's about forming an interdisciplinary team to assess the local situation, develop a strategy for the local environments, and for that, say, particular route if it's an airline route, or for the school if it's a school that we're looking at.
Thank you very much. Thank you very much. And then just maybe if we stay there on that testing, Pascal, is that are we moving towards a universal standard or reciprocity on that testing process? I had been reading a lot of airline companies, and they are anxious to even perform their own testing so they can fly again. The industry is being challenged, and airlines are, many of them, they are in the breach of bankruptcy. So how close are we to some kind of a standard, at least that will allow us to board back again into a plane?
And Carlos, you're right that we airline, we would like to be able to test our passenger, in a systematic way. And to the point made by Aginta also, I want to say also that we have to be consistent across all the journey for the passenger, because I have seen some case where, we were boarding an aircraft in a very well organized way, but people were piling up in the bus going, from, the gate to this. So what is important also, everybody is talking about the aircraft, and we like, of course, to be the center of the world. But what is really important is that you have a consistent experience for the passenger and a safe experience all across the airport. So in the city, at the airport, at the gate, when you are in the aircraft, and then when you arrive at destination. So it's really important that we align all the parties, which is one of the challenges that we have, because we have so many people that needs to collaborate. Now, to go back to your question on the testing, yes, we would love to have enough tests to be able to test everybody. But I understood that one of the risks or the issue that we have to deal with is that we don't have enough tests to be able to test everybody. And I can see the situation in Switzerland that in some cantons, they have decided actually not to test everybody, because of course everybody is managing the scarcity of tests, unless, because I'm talking about the PCR test, unless we come with a new method of testing that will be good enough to manage the risk at the level that is acceptable. And so having this new test, fast test, plus mixing with artificial intelligence, so contact tracing, everything that Chris was mentioning, yes, maybe we can find a solution that will be scalable and that will be available for everybody in the world.
Yeah, thank you very much. And that goes in line with some of the recommendations. And then the fastest and easiest way will be a self-test. Then you can test yourself. But is that technology? And this is actually a question on the chat. Is that technology reliable on the 5-minute test? Constance, what is the process of trust this test?
Okay, I can tell you because we had to change something for the mass production. When you start making mass production, you have to optimize all the different items you're producing, and we changed the size of our chip. So the tests we did, we have to redo them. But I can tell you by now that we are completely comparable to PCR. we are improving even more our PCR test value. Yeah, that means that we're gonna have a very, very good result and reliable.
So that's great news, because in plus of that, and we are working together on that, on ensuring that the data of those tests is confidential and is encrypted, and the identity of the user is anonymized. So we are slowly getting to what I believe is going to be a kill app for the entire industry. So on that, Chris, you are doing something with some Caribbean islands, which could be a pilot. I guess everybody is waiting to see a place where this works. I am in contact with the Canary Islands, for instance, and they want to have what they call safe island status. So they would like to establish direct relations with airports. So people traveling to Canary Islands, they can benefit from that. A bilateral testing procedure. You have some concrete cases there. Maybe you can educate us on that.
So maybe going back very quickly to what's been said, right? The scarcity of tests is really a problem right now. But and if you want to do pandemic management, meaning you want to know the risk of everybody, you have to theoretically test everybody all the time. And the way we use AI today is that we are able to say who should be retested and who shouldn't, right? If you meet nobody, or if you only meet your family, and if you're symptom checked all the time, then you don't need to be retested all the time. But if you are potentially a super spreader, someone who meets a lot of people, and you're very active and these things, then we might want to test you at a much lower risk status just to make sure that you're not spreading. And this is exactly where we're going with the artificial intelligence approach. And this only ever works if all the data coming in is secured, right? We have to know that the test data coming in has to be reliable. There has to be a certificate signing it. We need to know that the symptom data is reliable. We need to know that the tracing data is reliable. And if we don't know that, then the risk is not reliable. But if we do, then the risk is reliable, and we can do all this. So far we have been testing this in Latin America at universities, and it has worked really well. Of course, there's a lot of ethical questions, right? In order to do proper scientific research, you'd have to have a control group. And you'd have to have this control group not use any social distancing, because your managed group is not using any social distancing. But ethically, you can't do this, because you would expose all these people to a much greater risk in an area where you have a very large, the R factor is 3, right? So you have to really, you have a lot of data problems. This is why what you're saying is islands are perfect. And we're working in the Caribbean mainly, and in the Asian parts of the world on islands right now, deploying these and bringing those into resorts, and that works really well. One of the biggest challenges that we've discussed is here also is how do we do debarkation, right? Someone who comes to the island, let's say you go to the famous Caribbean ones, right? You present your test. And it's handwritten. How are they supposed to know that's real, right? There's no way of entering a person like this into a pandemic management system on the island without having that test certified. And this is why it's so important that IATA and the authorities work together so we can actually certify these tests, because then on the islands, we can run the pandemic management and we can literally push out the disease because we can manage risk so well. On this, and I think that the islands in the Caribbean are perfect. Their main season is coming up right now, and this is a place where we go along. You'll see, but next week we have an event which is called the Future Hospitality Summit, and we'll be revealing the tests there, the pilots there, and we'll also show how we've secured this with WISeKey's technology. Right, so it's I'm sure I'll see you there.
Very good. Thank you very much, Chris. On that, maybe if we can work now at the level of the let's say Geneva government. I mean, in Geneva, you have one of the leading airports in Switzerland, number 2 in traffic. You have the headquarters of companies like EasyJet, which is suffering big time. They just announced reducing drastically their staff due to the COVID situation. The Geneva airport is losing money, first time in history. So how do you see, Gianfranco, the use of this technology in a practical and I will say fast way, because obviously this organization cannot wait any longer. They need to start to move now into some solution. We also have obviously WHO in Geneva, and Geneva just announced with the Canton de Vaud last week the Trust Valley, but actually WISeKey is one of the founding members, and it's an initiative actually to further reinforce the trust model required to maintain all this digital transformation that is happening thanks to the pandemic. So your views on how a city or a canton like Geneva can immediately leapfrog and become a thought leader on that will be highly appreciated by the team.
Sure. What we saw is that we have been reacting very quickly, but in a very coarse and brutal manner. As you mentioned, the impact, social, economic impact of measures that we have taken to try to control the pandemic are just staggering. And you mentioned the airport. The airport that 18 million travelers are going through in 2019. We are down to 20% of that number. We have to cancel the major car show, the largest public event in Switzerland. 700,000 people would have been attending. The economic impact for the state is more than 250 million. So it is, we're talking about significant. Of course, I mean, we want to be much smarter in the way we actually make these decisions. But having just on or off type of decisions is not compatible anymore with what's going on with the economy, with social interactions, and we need to be much smarter. So if artificial intelligence can help us have a much more selective way of dealing with this, if we can test much faster and much cheaper, the people are actually infected and try to better control the spread of the pandemic till we have a vaccine, then I think these are actions that we need to take immediately. I think the state will probably be interested in running some experiments very quickly if this technology becomes available. That's something that is a matter of survival for some of the industries that have been impacted.
Absolutely. Yeah, especially on an international city like Geneva, where the United Nations organize every day a conference, WHO, ITU, ILO, WIPO, and these conferences are being all canceled, so that is a huge impact in cities, international cities like Geneva. Now, so there's a question from Christopher Klenner that says, how to convince governments to give green light to the airline industry, cruises, large-scale event, etc., given that always will remain a residual risk. Obviously, I mean, we are not in a risk-free society, it has never been. So maybe, Aginda, as you're working with VirusIQ and we are actually working on WISeShelter, maybe what is your views on using WISeShelter technology with VirusIQ as a way to answer that specific concern?
Yes, Carlos, can you just repeat that last sentence? What is your views on?
No, how VirusIQ and WISeShelter can be used to basically reduce the risk and start to allow these organizations like cruise, like airlines, to use technology as a way to reduce the risk.
Yes, so the WISeShelter, we've partnered with WISeKey to bring about this solution. And so by using the risk analytics platform and also adding in, these multi-tiered test result information as well, we can preserve, speaking to what Pascal was saying and the rest of the panel, we can preserve individuals' identity and include the telemedicine, remote care, have the attestation of the lab testing certificates as well, and then just maintain privacy and just share the status where the person's negative to the WISeShelter pass. And then they can use that WISeShelter pass, which has a QR code or some form of code at these events and enter these events. The pass can then be geofenced, can be time limited. So the receiving institution, the facility or the venue, can be a lot more confident that this person has been screened So they've been screened from in terms of their exposure, their symptoms. They've been screened in terms of their test results as well. And then that this person is clear for a certain amount of time while they're in the venue. And then the other part of that is obviously post-event surveillance. So post-event, the individual can also be part of this screening process. And so we can monitor anyone should there be an outbreak and where that outbreak is occurring. And if we do it in a privacy preserving way, which is what each individual is concerned about, you know, they don't want to give their information to third parties, you know, to restaurants or wherever they go. So if we do this in a privacy preserving way, then the individual is going to be more trusting of the platform, and they're going to be more willing to use the platform. And so digital inclusion and adoption is a huge problem at the moment, and it's something that we really have to consider. In terms of digital inclusion, I think the other thing to consider is that we have, you know, you have mobile apps, but not everyone has a mobile phone. And say children don't walk around with mobile phones. So how do we implement other solutions such as, you know, contact tracing wristbands or, you know, wearables, other tool sets that we may think of that can also be brought into this solution mix so that they can also be secured. And this is where the IoT becomes important. So they can be secured and also have a way to recognize who may be at risk or not at risk. So I think that's what we're working on. And I think the WISeShelter Path is a great nexus for all of our solutions to come together.
Thank you very much. Just to brief the audience on WISeShelter. So WISeShelter was an initiative that WISeKey launched in February as a way to give basically the use of cybersecurity, identity management, and the possibility of associating that with IoT as well, because it has a microchip component, into the possibility of creating secure and trusted apps that can be basically expanded with the partnership that we are establishing with VirusIQ, but also with Pierre and with Chris in Arago and Digit and even Ayata, as a way to trying to create something that works and allows people to move away from the non-decision process that we are now into a more proactive approach. Obviously, with all the limitations, they still might have, but our position is better to have something that works, even if it's not perfect, than wait to have perfection. Perfection is the worst enemy of just good, right? So we would like to move that to the market. Maybe Pierre, in that line, your views on how do your organization can contribute to that as well.
Well, I think you said it perfectly. That perfection first is not the way to go, and second, that we should be really proactive here. And I think maybe this year people realize how important the area is now, because now in the field of healthcare in general, we generate so much data. In the field of healthcare, for sure everyone knows about this paradigm shift that we have, which is called the personalized medicine. But there is still one more important paradigm that's currently taking care. Is really this shift from treatments to more diagnosis, to more monitoring, to more prevention. And in this field, it's clearly that's AI generating big data and to have everything secure, because this data have to be handled properly, is become very, very crucial. And this year is very special of COVID. I think now people realize how important it is actually how to secure all the data. Again and again, that's the technology that have improved so much this last year, especially all the multiplex assay, because yes, it's not only about generating one test, RT-PCR test for one person, and big data meaning that we measure that on a lot of person. No, big data now is about that we generate gigabytes of data, biological data per person. That is a completely different level that's now we are entering. And for sure in that field, the security of this data is becoming crucial.
Absolutely. Maybe on that, Hans, just digging back again, one of the limitation of AI from my experience is that data in some cases is still reside in silos. And obviously AI needs to analyze data that is not restricted and data that is authenticated at the origin. So how, from your experience with Hero, how do you solve that problem on being able to just pipe all the data in a trusted way that you know that it's not fake data, because fake data means fake AI diagnostic bag? How do you solve the problem of silos? I mean, I know blockchain is aspects of that, but the society is still in silos. I've been talking to a lot of cancer research people, and they are telling me if the data of cancer will be available, we will be able now to advance in this cancer situation much faster than we are now, because the data is still in silos. So how do you solve that problem, Chris, with using AI?
I mean, this is actually very interesting, where COVID might be an opportunity for all of us, because all of a sudden these questions are being asked, right? The cancer problem that you're mentioning is years old. Everybody knows it, but no one is doing anything about it. Now in COVID, we're actually actively finding solutions and talking to governments and regulators and so on about this. I mean, as I've said before, our primary risk model today uses test data and controls testing. It says who needs to be tested again. It uses tracing data to understand, like, tracing within the protected group and how many people outside the protected group have you met. We don't know what the actual contexts are and so on. And it uses symptom control, like measuring temperature, heart rate variability, breathing, this type of stuff. And this only takes seconds, right? You have to look into a device for 3 seconds and this data is available. Now, the problem is, as you mentioned, that if this was fake data, if fake data was injected into the risk model and the machine would learn from that, then obviously there would be a tremendous, horrible opportunity for cyber attacks. And this is also why you've seen a lot of AI applications working inside digital models that were completely done, right? In business, most AI was just inside models that were already digitized and nothing happened. And the big step that we're now taking with AIoT together is actually securely connecting the physical world to this. And it is so important to connect the physical world, because that's the real data you need in order to make any decision that goes back to the physical world. And the only way to do that is by introducing end-to-end security. There is just no other way to do that. And if you introduce the end-to-end security, meaning you know this test has actually been performed, and you could go and find the person who has performed the test and the person who the test was performed on, if there was any irregularity, even though then you'd have to go through a process where the person that this concerns would have to get a notification saying, yes, I want to get in touch with these people, or no, I don't want to get in touch with these people. This is how the digital twin works, right? But in knowing that you even have this opportunity, knowing that you're connected to a real device, a real test, a real symptom check, a real tracing application, and not just anybody injecting data and saying whatever they want. That's the key to even running these models, right? Without these, AI, I mean, there's been a lot of talk about AI and how powerful it is, but it was so far only inside the part of the world that we had already completely digitized, and you could not really apply AI to the physical world. And now with the approach of AIoT, we've greatly expanded the applicability of AI to all the things physical. And in order to manage a pandemic, we have to be physical. There's people, there's tests, there's symptoms, there's locations that they are on, there's context between people, totally undigital, and all of that needs to be secured. It's the only way to do it.
Totally, and we have been observing that in WISeKey as the IoT, Internet of Things, combined with AI, is creating a totally new industry with the artificial intelligence of things. And what we realize is that another aspect to reduce the COVID is being able to connect the physical locations, not only airports, because that will increase airport security, the airlines will increase access control security, but even the hospital and clinics where patients are being treated with, in many cases, with very obsolete equipment that in some cases is a cybersecurity threat. So the Internet of Things and the fact that we are moving billions of devices to the internet is going to increase the quality of data, because those devices with digital identities and microchip will be able to send encrypted data to you, and you should be able, with that data, knowing that comes from authenticated devices, to perform AI operations on the top with total confidence. So in thinking on that, Pascal, one question I really believe the the airline industry is the key industry here. I mean, because a lot of people are asking us, how can we activate the events, the hotels, the travel agents, the cruise? But if we cannot travel, if we cannot take a plane, nothing activates. So without solving the airline industry problem in priority, I think we are going to go in circles here. And the World Economic Forum has this Great Reset initiative, which is actually resetting. But what about resetting the airline industry? I mean, it's still a very analog industry. From my experience, don't you think that a consortium of, I will call digital transformated airlines like Lufthansa, like Singapore Airlines, like Emirates, as an initial players here, could create the I will call the core of interoperability required to expand that to other airlines, and then get the reassurance that is required for regulators to open the space? Don't you think this is a way to start?
Actually, yeah, this is what we are trying to do, because the challenge that we have is that we have to invest in order to accelerate the safe and secure digitalization of our industry, but we don't have resources to do it. Yeah. And at the beginning, you were mentioning that, most of the airlines, they have 6 months of cash in front of them. And at the moment, the forecast that we have, we don't believe that in 6 months, the crisis will be solved and we will be back to normal. So yes, we have to do it, and because we cannot think about the world without moving people and moving goods. So for us, we are part of, we are in the business of freedom, and so of course the airline industry is important, but any travel industry is also important, because we need to keep moving people from countries to countries. So yes, we have to, and the travel industry is a good test bench, because we had already safety in our culture. So the biosafety, or the safety of the passenger, or the safety of the aircraft is more or less the same. In the past, we were scanning passengers to make sure that they don't have a bomb or a weapon on them. Tomorrow, we will scan passengers in order to make sure that they are not going to create a risk for the other passenger. More or less, it is the same the same process. And yes, we in the airline industry, because we are a global industry, because we are interconnected, yes, this is the best way to do it. On the other side, it is a very complex environment, because inside an airport, you have about 200 subcontractors that are working together. John Forco knows the problem of the smart cities. So already an airport is already a smart city in itself. And so it is a complex environment. And I agree with you that the only way to address it is to simplify it. So to build a model, a template that will be simple enough so we can guarantee the security of the data, because it looks like at the end of the day, it will be securing the exchange of data between parties, because we will have solution, we will have a quick test, we will have a different component, but we will have to bring all these components together. And so it is the end-to-end security that some of the panelists was talking about. It is very easy to say. It is quite complex to implement, especially when you are working on the global level, where you will have different cybersecurity jurisdiction. A cybersecurity law in China is different than cybersecurity and data privacy law in Europe, and it's different also to what we have in the US. So yes, it's a good opportunity to do it for airline, but it's already an opportunity that has its challenge already.
So maybe we can talk a bit about who is going to put the money required to make this happen, because you all run companies and projects, and funding for the moment we are putting money from our own pockets to make these initiatives. But obviously, this is not only our responsibility as entrepreneurs. The governments and European Union and private equity. Actually, we have on the call something like 100 private equity and investors. Then they are looking at us to see whether this is going to be the next industry to invest. maybe views from all of you in how do you think we could help you enhancing your capability of deploying what you're doing, and what are the sources of financing that you see possible? And maybe start with you, Hans, Chris, because you are advisor to Chancellor Merkel. What are you telling her in terms of Europe? I mean, this is a big play for Europe. Europe could take a leadership on this. We know that the European Union wants to launch this digital identity project for European consumers. What about if that project becomes this ecosystem that we all require to start to running tests on trusted identities, get that data in compliance with GDPR and EDAS, which are things that the European Union is already doing, and that could be actually the big opportunity for Europe innovation to leapfrog into something bigger and better than what is happening now in this $10 trillion ecosystem being built by social media companies, which are very well described on the Social Dilemma Netflix video. I mean, that you can see the promise there. But what is the solution? Can Europe benefit from this, and can we raise money from this organization so we can properly fund this endeavor, collect endeavor?
So let me give you my wishful thinking view, and then maybe bring this back to the real world. I think that we are on a very tight time schedule here, right? So if this problem is not solved by Christmas, basically we'll see a lot of airlines die in the first quarter next year, and a lot of travel simply goes out of business. And that means if the transportation is gone, right, all the destinations have a problem, because no matter what they do, no one can come. I mean, you've mentioned this already. So the problem with this is too short term for politics to achieve anything. Like, seriously, to get in. I think that this is a question of companies making a step. The investments that we see for testing, for the AI platforms, for tracing, for symptoms control, these are not huge investments, right? I've been talking to a fair company whose revenue has been going down from 700 million last year to expected 20 million next year. They're losing so much money every day. If someone says, like, look, I can fix this for you for a 5 million initial investment, then you should just do it. The problem is that a lot of these companies are afraid of moving, because they say, like, as long as I'm just waiting for some authorities to tell us what to do, then at least I haven't tried anything crazy, and nobody's risk. We see a lot of people who have much more of a human life problem, like in South America. The companies make decisions. And I think that with the companies making decisions and running this and having their own secure bubbles, that is an opportunity where in the beginning Q1 of next year, if the companies already have deployed it, most likely the governments will step in and say, like, okay, we will finance the backbone to interconnect all of this, because that's what they're used to doing, right? That's how countries interact, how they like to regulate roaming and so on. Either this is a big business opportunity for someone to do it, or is going to be a government initiative. But I think that the first steps have to come from economy itself, because look, I mean, we all have the interest that economy comes back online. Government has the interest that not too many people die. The government exists in an economic high time and an economic low time, right? But we all prefer to have an economic high time. We have to make the first step has to be done on the commercial side. And you've seen all the entrepreneurs like you or I, we've made the investment. And I think that the users now, airlines, airports, venues, and so on, are the next to make the investment. And I think the backbone will be taken on by government. Of course, that also has financing opportunity, right? I mean, whoever is with this now will be able to sell it on for a lot more.
But I work in the UN and for many years, and in crises like that, it will be normal that a fund is allocated to somebody like IATA to face the immediate requirements. I mean, we are talking, as you say very well, this is not a year or 2 years. This is a problem that needs to be solved by December.
Exactly.
And without a clear solution, it's not going to happen. So why, with all that money that is available on COVID crisis-related money, why that money cannot be piped into implementing a project with an international organization that has the mandate to do so, and the money's there, and the entrepreneur strength is there too? How we can put that together? Who starts? And maybe Pascal can guide us on that.
Yeah, the challenge, and I agree with Chris, it's not a question of money, because every pilot needs only a reasonable amount of money, and it's not huge. But the challenge that we have is that once you have a pilot that has been proven and tested, then you want to scale up. And this is where you are starting to see the problem, because the pilot that we are doing in Aruba tomorrow will have to be also implemented in Hong Kong. And it means that all the standards will have to be accepted by the regulators. And the challenge that we have, and we have seen it even in Europe, where you would expect that inside the European zone that we will have a good coordination between the countries, that we need the regulators to agree on what will be the governance and what will be the framework that we will implement in order to guarantee the security end-to-end. Once we have this framework, it will be quite easy to implement and to develop. And I agree with Chris, we prefer this to be led by the business, and then the regulators to validate that what the business is proposing makes sense. So this is the best approach, and this is what has been successful in the past. But it's really, to have a governance that, what we will implement in one place of the world will be accepted in another place of the world.
So if maybe I can jump in very quickly. My experience here is that, and we're doing this in Latin America and in the Caribbean, and now we're having these conversations in Frankfurt, in Germany, for example. And we've presented these models to the health authorities, and they all love it. I mean, the point is that someone comes along, has solid mathematics, and says like, look, this is how it's calculated. Is this acceptable to you? They say like, yeah, that's exactly the type of solution we're looking for. But it's not their own job, because they only have to prevent exponential spread. If a part of the economy comes along and say like, look, this is the model that we can use to bring economy back to capacity, I have not heard a single problem with the regulator saying like, no way.
Yeah, I agree. And again, I was, as I say, last week in the Trust Valley. One of the things I mentioned in public to everybody, that while we keep talking about bringing trust to Switzerland and all that, we don't have enough focus in the investment in Switzerland to create this ecosystem, latest stage ecosystem that will allow us to create the technology infrastructure, cybersecurity, that will allow us to develop a Trust Valley on the top of it. So we are talking about money. I mean, there's a lot of money available, but I still believe that there's no structure like a private equity group that will be focusing on COVID-related technologies, or something that will allow us to pipe the investment required to make those applications universal. Maybe Constantin, because you are in the middle of that, you develop something, you want to scale. How do you scale today? Where do you get funded, and what is your business model to scale what you're doing?
Well, this is really a good question. Well, we were funded by normal investors, and by the moment we started, everything went fine. But until the moment we said, okay, we want to scale in huge amount, making tests in millions, and the problem in that moment arises because today everybody is trying to develop a test. That means that you have to calculate 6 months in front by buying. And if you consider that you want to sell each month 1 million units, you're making 6 million of units in your forecast, yeah? And you have to pay them for a risk buy. That's how the providers call it. You have to pay in advance, and then you're losing really a huge amount of money, yeah? And to be honest, we are in that, and we really don't have yet the solution. We have, of course, investors that want to come into the company, but as we don't want to get diluted, we are still trying to find another way to finance the whole party.
I agree. Ajida, also, you are in the same situation, I believe. Maybe your views?
Yeah, so what we're also working obviously with our IT platform, but also with diagnostic companies. And I think to echo what Chris and Pascal said, what we're seeing is that governments and regulators the regulators are moving fast actually, but governments are much slower to the party because they feel that they feel that they have a lot of risk of reputation, and they have to consider the whole population in a solution rather than individual businesses seem to be able to move faster in agreeing to a pilot or agreeing to a solution and putting in the investment required to get that over the line. So say where there's an airline willing to move into a pilot phase and putting in the investment, I think that's where the movement is happening, and that's where the investment's happening. And that's where the diagnostic companies are securing their supply chain. A big issue for diagnostic companies is to make sure, as Constantine mentioned, is that their entire supply chain is secured for not just the pilot, but for the rest of the contract, for the implementation. So you need investors and you need the customers who are willing to say yes to a certain period of time of buying or purchasing. And so we're seeing that with, say, airlines and individual companies rather than governments. Governments tend to be a bit slower. But what I think where the governments are coming in is that if you can prove something with a pilot, then I think we can start to ask the governments for extra funding or extra support in terms of scaling and growing the solution. I think private equity, as you mentioned, is a key industry to support this. There's angel investors, obviously, venture investors, and I think they are already in the mix. I haven't really seen a lot of movement from private equity, and I think there's, especially for the scaling and growth of companies, I think there's going to be a lot of return for private equity companies should they wish to enter this market. And I actually emailed private equity companies back in January. So when this crisis was unfolding in China, we had kind of almost, before it was declared a pandemic, we had called it a pandemic, and we had started developing the solution then. And at that stage, some of the private equity colleagues may know that I had emailed them for investment back in January, February. And hopefully they'll come to the table towards the end of this year once we've got the pilot results available. So I think there's a myriad of people who'll need to come in to work together.
I'm sure they will. To be honest, I think the work that is done by you guys and us helping you as much as we can is extraordinary, because with the $10 trillion ecosystem that is in place between Facebook, Apple, Twitter, and these guys, I mean, they should be their responsibility to really take care of this, but they cannot, because they are compromised in their business model, because their business model is to collect data. Their business model is to collect identities. Their business model is to sell us, right? That's very well documented now. I've been telling that for years. So obviously, if they try to enter into the COVID, they will use the COVID as basically another way to make more money than the money they are making. So it is a unique opportunity to reset. I don't know if you have been following the IPO or the listing of Palantir and how critic he is on Silicon Valley and the forces there, and that's the reason why they just make a direct listing versus an IPO, because they didn't want to depend on the venture capital community, which are all pushing these social media companies, and they are obsessed about the social media company. I mean, this is a new opportunity for the investment community to basically invest in something that protects the identity of users, protects their data, improves their health, develops the digital transformation of the entire industry from home all the way to the destination, and including the health industry that goes with. So it's a total digital transformation. Even we are totally unfunded. I mean, this is very small amount, the money that is invested in those companies like the ones that you are running, to solve such a big problem. This is a very big problem. This is a generational problem. It requires the private equity and investors, and they are following this debate today, to help you guys and help us to bring that to the next level, because I think we need to bring those values. And one question here, by the way, from the audience, Joseph is asking a question: while artificial intelligence continues to be designed and developed by humans, with algorithms provided by humans, value system provided by humans, and data set provided by humans, how artificial is this intelligence? So maybe, Chris, I give you this question to you. You know, it's that, what is this artificial intelligence? And I mean, artificial intelligence has been challenged by being potentially biased. And I think maybe we can talk a bit on the technology. If we're going to design a better society, let's use the technology in a wise and in a way that is wise and adaptable to end users. So maybe that question to you, Chris.
I mean, this is it's a very good question, right? Because the term artificial intelligence is not a good term. And I think that everybody knows this. A lot of people try to replace this with a technical term like machine learning, but that only is a very narrow part of what we today describe as artificial intelligence. I think what it's all about is problem solving. And problem solving can be done by a machine, absolutely, but it will always use the human element. Like either it's humans teaching the machine directly, or it's humans producing data while they're working, and then the data is used to teach the machine. So it's always human knowledge that is put in there. And this is why what we today call artificial intelligence and what is real intelligence in us humans is not related at all, right? In the end, these are still stupid tin boxes. They only have the ability to take the knowledge that and the experience that we as people already have and put that together to much more individualized solutions much, much faster. So you can think about AI can be used to scale us. I mean, that's what it's all about. And that's what it's all about in a pandemic, right? I mean, we know how to handle pandemic as people. The medical community knows how to handle pandemic. The problem is there's simply not enough medical personnel in the world to handle the pandemic the way it should be handled, or to proactively do risk calculations that are out there. And this is why we need these artificial algorithms that reuse that knowledge, reuse this experience. And experience can be given to machines directly, right? I can give a machine an information like this is a stop sign, or I can have the machine examined in data where all of these people have stopped at a crossing, and then there's also a stop sign present. So the machine will draw the conclusion, this sign must mean stop, right? So it's always human knowledge that comes in. The thing that we find so artificial about it is that the speed of decision making has gone so up. And I think that the ability to solve problems on an individual level, no longer needing the typical industrial cycle of how to use economies of scale, that's really what artificial intelligence does. And it comes very close to us with a pandemic like COVID, because all of a sudden it really is a totally individual problem. It's my problem of not getting sick, and it's your problem of not getting sick. And I think this is the real challenge that we're facing, but it's also the real opportunity, especially if we connect it with the physical world, which is happening right now, and make that secure. So yeah, you're totally right. Whoever asked that question, this intelligence is not artificial. It's just replicating us. And the risk that everybody's talking about, right, is that it's also replicating our bad behavior. And this is what we have to weed out by securing these type of solutions end to end. And this is why only with the security, the actual entering of the physical world into this decision plane of automated problem solving becomes possible.
Pretty great. Thank you very much, Chris.
Sorry, a long answer for a short question, but it's really, that was a very good question.
It's a critical question, and it reflects the opinion of a lot of people who are concerned with artificial intelligence. So I have another question, which is, are you considering, I mean, this is more for Pascal, but anyone that wants to answer that question, are you considering opening new lines in the European Union with less important airports in Switzerland, like Lugano or Sion, or countries less involved in COVID and that have adopted security measures? So basically, can we move away from the big hubs and pilot a test pilot in less important airports?
So I don't know. I don't know the answer, and it's not something that I'm directly responsible of. What I can answer with my feeling is that at the moment, airlines are struggling very much, in order to predict the capacity that they will need in the next 2 weeks. They have absolutely no visibility. And because they don't have also cash as well, I would be very surprised that, of course, they will move into redesigning their network and opening a smaller route. To give an answer to this question, there is another concern that we have, which is also the protection of the planet. And so maybe I can see more a redesign of all the global airline networks coming from, of course, a better protection of the planet and the reduction of the carbon emission, which means that we will have smaller aircraft, of course, with less emission or with hydrogen liquid engine. So this is probably the protection of the planet that will drive the redesign of the network of the airlines.
Thank you very much. Yeah, I fully agree. By the way, environmental protection is a big subject within Treated, but a lot of these COVID-related issues are very much in direct line with the Sustainable Development Goals of the United Nations, right? Including identification for all. So maybe another big industry which we're not covering here, obviously, because the subject was travel and airports and airline industry, is the education industry. Agenda. One of the, I have 6 kids. One of my major concerns is always keeping them safe. You are doing a lot for people going back to school. Maybe you can educate us on that and what are the similarities that we are talking here?
I think there's a distinction between the different grades of education as well. So there's schools and then there's universities globally. And a lot of these schools, I think, are suffering just like airlines. So a lot of their income comes from international students and obviously comes from being open. So I think as they've had to invest in virtualization platforms and hybrid programs, and they're struggling even in terms of having enough teachers to facilitate these hybrid programs, because you need more teachers actually for hybrid programs than you do for normal classes. So I think schools are facing significant difficulty, not just in terms of cash flow, but in terms of having to reorganize themselves entirely to handle this pandemic. And they have significantly less. So the universities might have a lot more cash flow, especially the well-endowed universities. And they also have in-house talent for developing testing labs and, having their own operations in-house. But K-12 schools, they are struggling, and we're trying to do pilots in schools at the moment. And one of the things is about funding. So it's much harder actually to get funding for schools. And this is where I think there's a lot of companies who may want to engage in corporate social responsibility or engage in kind of even their local school community to try and help them develop solutions. Another aspect to solutions in schools, we're working with the Brooklyn Law School in terms of digital health and regulatory reform, and in terms of privacy of children's data. So children's data is obviously something to really consider, because what we do now may impact them in the future. So we have to consider how we protect their identities, their data, and give them, and the schools are using things like Google Forms. Google's quite secure, but at the same time, these are not solutions built for purpose. So we need to develop tools and solutions for purpose to protect the children, because we need to protect where their location is, their identity, as I said before, and also protect their ability to learn in this, kind of challenging environment. So I think schools, we're working on the regulatory side in terms of developing regulation to bring in these solutions for schools, which is a task that a law school, as I said, has been helping us. And we're also trying to work in Switzerland with schools there. And I think we have to, speaking to Chris, would have to discuss how AI can be used to bring in low cost and highly scalable solutions for schools. So it's a challenging space that we're just starting to get a bit more insight into. Airline seems easier. Sorry, Pascal, but it seems easier than managing the schools problem.
For sure, for sure. So maybe, Gianfranco, one of the sad statistics about all this is that since the pandemic started, we have something like 400 million people unemployed in plus of what we had before. And we have 30 million people, and this is a statistic from the United Nations, 30 million people that have entered into basically what we call the very poor ecosystem, people that live on less than $2 per day. So if 40 million has entered into that, imagine how many more there are people than they are basically in extreme poverty. And this is reducing the Sustainable Development Goals perspectives to reduce and eventually eliminate poverty, as this was one of the major concerns of the SDGs. So you have been seeing that in Geneva. I mean, we are one of the most rich cities in the world, and we see the number of unemployed people that they are queuing actually to get a parcel of food. You are working now on the social side of the Geneva government. So how will you use all these technologies to alleviate that problem?
I think some of the services that the government can provide are not necessarily well used by the people who are eligible for it. So I think that one thing that could be really improved is the accessibility to the services. That would involve technology for electronic identity, for instance, to facilitate access. That would involve maybe blockchain technology for consent management, where you could delegate some of your rights to someone who is practical in doing the applications, for instance. I see a lot of potential also for artificial intelligence to make it much more natural for people to engage with these procedures. You must have heard about GPT-3, for instance, just recently, and all the breakthrough in that area where we could use artificial intelligence to really have a more human-like type of interaction that could then, facilitate access to the services. So I see the technology as an enabler for people to get a facilitated access. And also, I mean, there is everything that we can envision using the technology for in terms of compensation for trading time and services that are not monetized yet, but could be sustained by a different model. And we could engage people who are unemployed, for instance, to contribute to the common good while at the same time being recognized for it and getting some value. So I see a lot of interesting applications to technology to leverage the social economic side of it.
Absolutely, and we are very happy to have you in that position because people like with your vision will accelerate that for sure. So as we are just reaching the hour and a half that we reserved for this, I will just maybe 5 minutes for each of you or even less. Just to do a moonshot, project your activities in the next 6 months, and where you see that there's going to be concrete milestones towards achieving what we are all trying to achieve here, a more safe society where we can go back again as much as we can to normal life. So maybe I start with Pascal and then Constantin and each of you. Pascal, your floor is yours.
Yeah, we hope that within 6 months we will be able to restart our industry. It might take longer than 6 months, but where you're right is that we have to take the opportunity to design something that will be more sustainable while we keep the safety and we keep our culture, our safety culture. The challenge is to become leaner and meaner, is also to be able to move faster because sometimes airlines are carrying a huge legacy. So everything like the pilot that we are talking at the moment, if we are able to accelerate this pilot, maybe yes, we can create a momentum where we will get investor, governments, regulators coming to us and helping us, to release the industry and the business, because it's obvious that we will have to live with this virus for quite a long time, and so we have to do it in a way that we can protect the safety of the people.
I agree. Thank you very much, Pascal. Constantin, your views?
Yes, I guess in 6 months we have at least Frankfurt airport under control, and will provide people to have a pleasant flight without any risks.
Perfect. I would love to go to Frankfurt Airport myself. I'll use that hub from there on. Chris?
Well, I'll go for the bigger thing, right? I think in 6 months we'll have a collaboration between actually all of the people here, and we'll be using Konstantin's tests to test all these people that are going through airports, maybe Frankfurt and Geneva, to make them part of a pandemically managed system. We'll be using the border control mechanisms that Clinic IQ is offering. And we'll be securing all of this with WISeKey and the AIoT part that we can bring. I think within 6 months, we're able to bring the air travel, at least in Europe, back up to, let's say, 80% if we join forces here.
I fully agree with you. I think it's with the caliber of the people we have in this panel, plus our individual networks, that could be accelerated. And there are many good platforms to launch this initiative. Agenda, next 6 months, you're busy. I know. We don't hear it. Just unmute yourself, please.
Oh, yes, sorry. I was going to say, I would echo what everyone else has said, and I would hope that we could have some successful pilots by Christmas so we can bring families together and bring some Christmas cheer, and to hope that that would just continue to, get stronger and stronger, and our collaboration too. And I think that this is a multi-decade problem. This is going to be a problem for years to come. So I think the investment now is very worthwhile in securing biosecurity into the future. So with WISeIQ, when we started in January, we thought of this as a solution not for a year or 2 years, but as a solution for the next 10, 20 years. So we're hoping that the next 3 months will be extremely fruitful, and that would continue on and grow stronger.
Thank you very much. Fully agree. Gianfranco, I know you are a government official, so you have to be very discreet in what you say, but I know that you are a visionary as well, so the floor is yours.
Well, you mentioned that we have launched this initiative, the Trust Valley. I would like to see that behind a potential vehicle for us to collaborate and maybe prototype something without being parochial here. I'd like that to happen in the Geneva Lake area first. And that's my wish for the very near future.
Thank you very much. And just to complement Gianfranco position, Mr. Pierre Maudet, which is the Minister of Economy, is very active in promoting this Trust Valley initiative. And obviously, Geneva has a major role because all the what we call the third trusted party, organizations, and they have a specific responsibility per sector. They are in Geneva, IATA, but you also have WHO in Geneva, you also have ITU in Geneva, you have WIPO in Geneva, and all these organizations are part of this trust model that needs to be built. They are still on the analog trust. We need to bring them into the digital trust, and that's the role of the Trust Valley. And in January, we're going to have the blockchain Congress, which is a very big blockchain event, which is becoming an international reference, because this is the first blockchain event that blends the technology expert with policy and regulators into Pascal was a speaker last year with this year actually with us. This event is going to take place. It's going to be a hybrid event. But if by then we can consolidate our thinking and put it together pilots, and we can demonstrate in that event, that will be a major achievement, both for Geneva, but for basically the entire industry. So just to, there is, we call that the Trust Protocol Association, which is an association where the Geneva government is founding member. This was initialized by the OISTE Foundation and WISeKey. Now IBM is member, Oracle is member. We have many other startups. So it is a good meeting place. It's a non-for-profit. The only thing facilitate the debate and the discussions. So all of you are invited, obviously, and the objective is to bring results in the next 6 months, and if possible by the end of January. As you know, the World Economic Forum is going to be now in May. So the month of January is kind of open, and this is a good opportunity to start the year very strong with concrete case studies and concrete recommendations. So you are all invited. So without that, I would like to thank you all for your inputs. Thanks to the audience. We had a peak of 185 people present, which is pretty good. This is being also broadcasted in YouTube and in social media. So you could expect something like 1,000 people following us today. And this video is going to be available, so you can also distribute among your members and your contacts. And we will organize another of these webinars a bit before the end of the year, so we can bring some updates on progress report in the discussions of today, and eventually invite more participants than they are working in cooperation with us, or even not in cooperation with us, but they're with the same objective to reduce this terrible pandemic situation that we're all facing. So thank you for your presence. Stay safe, and I am very proud of all of you and what you're doing, and we need to show our flag highly, so the entire industry knows what this is happening here, which I think is fundamental. Thank you with that, and with that I close the webinar, and I thank you everybody and the audience for your presence. Thank you very much. Have a great day.